My Lyme disease patient improved without an extreme diet. This is part of a Common Sense Lyme disease series where I discuss cases and questions that come up in my practice. I'm Dr. Cameron. So let's begin. My patient was already overwhelmed by his illness, and now he's overwhelmed by his dietary advice. He was looking at gluten-free diet, dairy-free, keto, paleo, alkaline, and so forth. It was hard to follow all those strict rules. He had a whole list of diets that he was considering. It could be helpful, and I have patients who are helped by these kind of diets. But I usually find that if I can focus on the illness and not on the diet as my first step, I take an approach of stopping alcohol, which of course can be difficult for some patients. Also, I have them cut back on simple sugars. Sometimes I have them have fruit if they can tolerate it well. But as the first step, so I can make sure they focus in on their illness, I find that if I stay away from strict restrictions, I have patients that get better, and this patient got better without having to do that extreme diet that's being discussed. The result is he improved his energy and focus. He had less digestive issues. I did use probiotics, and I find that that's often helpful. He felt empowered but not overwhelmed. He was healing without worrying about his food. So I don't have any problems with the diets that are out there. It's just that when I need to focus on the illness and focus on recovery, I work with at least the basics, and he fortunately didn't need to go to a more complicated diet. I have patients who are on complicated diets who I say, well, if it worked for you, and I have them stay with it. So sometimes small changes are helpful instead of extreme diets and doing everything at once. So thank you for joining me, part of this Common Sense Lyme series. Have a good day.